It's great to see you all pouring into this waiting room and into the meeting. I'm Nairi Kerse. I'm the Joyce Cook Chair in Aging Well, and I'm just hosting this webinar. I'm not really, we'll hand it over to John Parsons, who's really going to be the leader here in a minute. So we'll just give it a couple of minutes for people who are transitioning through the technology into the room. We've got just on 10 o'clock, so we'll give it a couple of minutes before we actually formally start the proceedings. So we're very excited to be able to offer you these webinars. So the vision for aging in Aotearoa is the joint Age Concern New Zealand and New Zealand Association of Gerontology conference. Conference was not able to be held earlier this year, or currently it will be held in 2021 later in the year around the time of the celebration for older people, International Day of Older Persons, around the beginning of October. In the meantime, we're very pleased to offer you this series of webinars. This is the third webinar, and we have a great lineup today. So I want to welcome you all to this joint offering Age Concern New Zealand Association of Gerontology webinar series. Now today we have a panel, Proceedings, and the panel will be headed up by John Parsons. I'll introduce John in a moment. The best viewing for the panel will be if you pop yourselves on gallery view at the top right-hand corner of your screen. You can toggle between the different options for viewing the webinar, and the gallery view gives you everybody when we get to the panel, and our wonderful IT people will make sure that you've got the right views as people come through. People will talk individually and then there will be in the panel. So I want to thank our sponsors today. So our major sponsor for today is the Selwyn Institute, who are supporting us, and there are many other sponsors. We've got the Petrol Guardian, Ryman's, National Science Challenge. So today's webinar is the Selwyn Institute, and there are many other sponsors who will show a slide at the end. So I'd like to introduce our host for today, our chairperson for the panel discussion, Associate Professor John Parsons from the University of Auckland. John is a physio and has been active in research and academic life for the last at least decade. Recently, John actually spearheaded the production of the TV Exercise and Healthy for Life TV series during COVID. And I'm pleased to announce that he's just been awarded a little bit more money from the funding agencies to continue that process. So John will host the panel today, and there will be presentations from each of the panel members, and then there will be questions. I would encourage you to put the questions you have into the chat function, which you'll see if you toggle along the bottom of your screen. Pop them in the chat, and there will be an opportunity at the second half of the question time for those to be presented to the panel. The webinar will be available on the Age Concern New Zealand YouTube channel after the event, so you can watch it again as many times as you like. So without further ado, I'd like to hand over to John Parsons, and thank you very much, John.
Thank you, Naomi. Kia ora, kia tātou katoa, te papai tapu, tēnā koutou katoa. Nau te raulau, nako te raulau, ka kite ki teke. E hoa mā Māori ora. John Parsons aho. As Naomi said, I'm Associate Professor at the school at the University of Auckland. I have great pleasure in chairing this discussion with our esteemed panelists this morning, titled Taking a Breath, Reflections on COVID-19. Online, we should have Dr. Ashley Bloomfield, Dr. Judy Blakey, Murray Edridge, and Simon Wallace. As I'm sure we all know, Dr. Ashley Bloomfield is currently the Director General of Health. He qualified in medicine at the University of Auckland in 1990, and after several years of clinical work specialised in public health medicine, Dr. Bloomfield's particular area of professional interest is non-communicable disease prevention and control. And he spent 2011 at the World Health Organization in Geneva working on this topic at a global level. Dr. Bloomfield was Chief Executive at Hutt Valley District Health Board from 2015 to 2018. Prior to that, he held a number of senior leadership roles within the Ministry of Health. Dr. Bloomfield's understandably busy today, and so has indicated that if he's online, he has to leave by 11:30. Our next panelist is Dr. Judy Blakey. So Judy is a life member of the New Zealand Association of Gerontology. She has a background in education, research, and community organisations. Judy's PhD from Massey University explored ageing with invisible hearing losses in the audible world. She served 2 terms on Auckland Council Seniors Advisory Panel, and in 2018, that panel's advocacy secured the councillors' unanimous support to enable applying to join the World Health Organization's global network of age-friendly cities and communities. Judy also chairs the Mairangi Arts Centre Board's of Trustees and provides health consumer perspectives as the Director of Comprehensive Care PHO and a member of the Precision Driven Health's Independent Advisory Group. Our next panelist is Murray Edridge. So Murray is from the has been the Wellington City Missioner since 2018. During COVID-19 lockdown, the Wellington City Mission faced unprecedented demand for its services, including increases in food distribution of over 400% and housing the entire street living population of Wellington City. To offset the challenges presented by COVID-19, the City Mission experienced significant challenges, financial generosity, from the public throughout the lockdown, and has benefited from the unique opportunity to explore what they could do and how they could do it. Murray's keen to explore how COVID-19 has offered us the opportunity to reimagine our future and improve how we serve those who need it most. Our last panelist is Simon Wallace. So Simon has been the Chief Executive of the New Zealand Aged Care Association since June 2015. It's Simon's job to make sure that the interests of the association's members and aged residential care sector are heard by government, public health sector agencies and influencers across the spectrum. As well as active involvement and engagement with members, Simon's day-to-day work involves meeting with government and other political parties, advancing the sector's interests with officials, preparing and presenting submissions, and actively fronting media as a spokesperson for the New Zealand Aged Care Association. So those are our 4 fantastic panelists. Now, I'm unsure if Dr. Bloomfield is online, but the first question is actually posed to him. If he's not online, then we'll move on to the next question. And that question, Dr. Bloomfield, is what do you feel have been the challenges that you have had to consider for older New Zealanders during the COVID-19 lockdown and restrictions?
Well, thank you very much, and kia ora koutou. I'm pleased to say I am on the session, and it's a real pleasure to be here and to be engaging with a great range of panelists as well. So, look, a couple of reflections here. First of all, the challenges. There have been generic challenges, and the initial really big challenge for us, of course, was that we had so little information. It's almost like the classic leadership challenge where you have very little information. For the first few weeks of the pandemic, I could personally keep on top of all the emerging published literature and studies from various countries around the globe. That has clearly changed now, but at the same time as having very little information, we had to give advice on very high stakes decisions. And some of those were decisions about just what older people should do, whether in the community or inside aged residential care facilities. And so that was, and in a sense, the evidence base is still emerging there. You know, the first reported influenza epidemic in Europe was in 1182, I think. So we've had a lot of time to learn about influenza. We've had a 9 or 10 months to learn about COVID-19. So that initial challenge was a huge one. And of course, what it required then was for everybody to bring what they had to the table by way of information, insights, intelligence. And for New Zealand, we were very well served, as we are every day, by our foreign affairs colleagues around the globe who were collecting intelligence in real time and providing that to us. In terms of older people, of course, we knew they were one of our important vulnerable populations, and that was a key driver for our response, was looking after the health and safety and well-being of the New Zealand population, but particularly our vulnerable populations, older people, our Māori and Pacifica populations with their higher prevalence of pre-existing conditions that put them at higher risk, disabled people, including those in the community and those who might be in facilities as well. So we had to think of those populations, and of course that meant that the response needed to come not just from organisations and not just health organisations, but from the wider population as well. And I'm sure we will come to this, and I'm looking forward to the kōrero about it. But you know, the call to action that accompanied our lockdown message, our request for people to go into lockdown, that inspired call to action, stay home, save lives, be kind, and the latter I think was fundamental in our success. Because every New Zealander, not just those who were essential workers or in decision-making roles or working for formal or providers or as part of informal networks, every New Zealander looked and saw what they could do to support those around them, in particular older people. And so in a sense, I talk about, people have heard this phrase around the curve crusher. Actually, the real curve crusher was kindness. We crushed the curve through our collective action, and in particular, our response to that collective call to be kind. And that will continue to serve us well, and I think particularly for this population. And I guess my final comment would be, yes, we did see COVID-19 in that first outbreak in New Zealand did get into some of our aged residential care facilities, but less than 1% of our total number. And we've taken the opportunity to learn so much by a series of reviews, by working collectively on those, identifying those lessons, and then what we might do about them. And that again is what will continue to serve us well, as if we keep learning and reviewing our response and pivoting to take on board those lessons. And I just want to thank other people like Simon Wallace, those working across the aged care sector, home and community support sector, and for NGOs for contributing to the knowledge base that we have developed here in New Zealand that will really stand us in good stead in coming months and years. Thank you.
Great. Thank you, Dr. Bluefield. And now I'd like to pose a question to Dr. Blakey. So Judy, from your perspective, from the perspective of older people, what have they identified as the key COVID-19 related challenges and issues that they've experienced?
And I find it quite difficult speaking on behalf of all older people, and so I just have to declare that I did consult and had a little focus group that was not necessarily all people in the same room at the same time, but I had conversations with a variety of people. And so I'll start off with the fact that Eleanor Bodger, who is the director of ElderNet, talked about the fact that for her, was interesting to notice how within their organisation, they were able to amplify the messaging that Ashley had spoken about getting information out, particularly around the residential aged care. But it's interesting because you refer to the kindness, and some older people were just a bit confused because they were being contacted by so many different agencies that they didn't know who they were talking to. And so there was an issue around being able to identify, basically, if you were phoned by Age Concerned and you were phoned by your doctor and you were phoned by, for example, Auckland Libraries, who also were doing those sorts of contacts, why there was this big fuss about you, because older people very often are understated in how they actually are wanting to be treated. I also, my good friend Peggy Koopman-Boyd, and I know, spoke to me and said to me, Judy, I don't want to be treated as an older person. I want to be treated as someone who has agency, who can decide for themselves that we can go out and do things. And my husband was very much aligned to that style and a way of thinking. But I'd say that one of the interesting things is just the everyday features of not being able to go out and do your own supermarket shopping, get the brands that you wanted to. Lots of people were offering chances to do that. But in fact, it's just that lack of personal choice in terms of the expression of your individual agency. And then the other big thing was I'd been able to transition to providing, to accessing health virtually. And that was challenging in a whole variety of ways for a number of people. And I don't want to take up other people's time, but I think from a dementia care perspective, that there was some issues to do with people with dementia not necessarily understanding the messaging. And so I think there needs to be more attention paid to how you develop and deliver those messages to people who perhaps are not really able to understand the consequences of what they're being told. So I think that's where I leave that for now.
Okay, thank you, Judy. Really valuable insights. So our next question is to Murray Edridge. So Murray, can you tell us about any issues that older people in relation to COVID-19, any issues that you might have seen at the Wellington City Mission?
Thanks, John, and Morena Tātou. Good morning to you all, and greetings particularly to my fellow panelists. This year, as for all of us, has been somewhat remarkable. I mean, we've gone places we never thought we would go, and likewise for the City Mission. And I know from my other City Mission colleagues around the country, the demands that we've faced this year have been quite extraordinary. And just to give you, and John, you talked about a couple of the stats, but in 11 weeks over level 4, level 3, in 11 weeks we distributed a year's worth of food. In our normal context, and as I say, we provided accommodation along with others for all of the rough sleeping or street living community in Wellington City. That was on the basis that social isolation was clearly going to be a major ingredient in our responding to the pandemic, which is wonderful as long as you have somewhere to isolate to. For those who are doing life really, really hard, that was an incredibly difficult and stressful time. In addition to that, for those who are really doing life tough, they have quite a sophisticated network of infrastructure and connections within the urban environment that they utilize, all of which pretty much closed. And the interesting side product of that is that people who had got used to living rough and couldn't envisage life any differently had the opportunity to be accommodated by people like ourselves over the period of lockdown. And that for many of them has been a life-changing circumstance or situation. We put them into self-contained accommodation with their own bathrooms and kitchenettes. We fed them, we cared for them. They had 36 channels of Sky TV. And for many of them, that was a life-changing event, and they currently still reside with us, and we hope to see that into the future. There are two things in particular I want to talk about, and one is about dignity and one is about community. And it's those two things that have really framed the conversation for us over this period. And if we think about older people, we've sort of looked at them in two ways. Firstly, as givers, and secondly, as recipients. And a number of older people are very good donors and are wonderful volunteers. Obviously, during the COVID lockdown period, the opportunity for people to volunteer was incredibly limited. And for a number of people, that meant they couldn't engage in their everyday activities. They couldn't contribute in the way they typically would. And that created a number of challenges around loneliness and isolation. And a number of our volunteers contacted us directly, feeling anxious, feeling fearful of what the situation they were in represented to them. And in addition, donors, and we had wonderful public support over lockdown for the things we were doing. And a number of the people I rang expressed frustration that being in isolation meant they couldn't contribute to the society in the way they would typically do, or the way they would wish to. And therefore the opportunity to give money was something that was significant in their context. When I talk about dignity, I talk about the dignity of choice often. And most of us have choices. We choose where we live, we choose what we eat, we choose who we connect with and engage with, we choose what we do with our spare time. For many people, they don't have those choices, and therefore dignity is a challenge. And what we saw during lockdown was that those choices were reduced even further. We talked about the volume of food we delivered. About 80% of that food got delivered direct to people's doors. And so we had the privilege of seeing people in points of really significant need, and having at least the ability to reduce some of the pressure by providing them with food supplies. A number of the older people I went and visited personally as part of our delivery mechanism, because at these particular times, everybody gets to do everything. And so all of my team were packing food, delivering food over the weekends and during the week. And I met a number of older folk who were really struggling with extraordinary circumstances, some of them looking after grandchildren, a number of whom who had sought supermarket supplies, but they were some days away and therefore had no food to fill the gap. But just that sense, the disconnection from the rest of the community. I met a lady the other day who had been at home on her own over lockdown. Her TV had broken down, her phone had failed, and she virtually had no contact with anybody for a number of weeks. And that in anybody's context is difficult. One of the things that happened over lockdown is we closed some services, and we did everything else that we do a different way. But we watched the people that we typically would care for and kept an eye on their well-being as far as we could. And one of those activities was what we called our drop-in centre here in Newtown and Wellington. And the drop-in centre was a place where twice a day we would feed people, a hot meal at breakfast and at lunch. And they got fed, and then they left. And after we thought about the drop-in centre and we watched this community, we said, how are we going to be post-lockdown? Where we'd change things or shut things, we decided as an organisation we wouldn't go back to where we were unless we'd analysed that and decided that was the optimal way to do things, which it very seldom is. So instead of opening a drop-in centre again, we decided to change the model. And we watched the people that we would typically serve, and actually they did get fed over COVID. What they didn't get community. They didn't have connection to other people. And so when the drop-in centre reopened, it didn't open as a food service, it opened as a community lounge. We renovated the facility, we painted and wallpapered and carpeted and put new lights in. We got rid of tables and chairs and replaced them with lounge suites. And the response has been remarkable. There's still food being supplied to people. It's just not the primary focus of the service. What the primary focus is connection and engagement. The primary focus is community. And in the first 6 weeks of opening post level 3, we had 3,000 people through the door. And some of them come for half an hour and have a cup of tea, have a chat, and they go, and some stay all day. And we've had the most extraordinary journey with these people over the intervening few months. And we've got a level of engagement and connection, which is something that we never had before. So one of the celebrations, I guess, that comes out of this very difficult time is the chance to revisit, to redo, and to think differently about how we might make a difference in people's lives. But for us, it was that thing about connection and community that was more important than anything else. Great,
thank you, Murray. That's fascinating. And so the final question around issues arising from COVID is to Simon Wallace from the Aged Care Association. So Simon, can you tell us about the challenges that your members have had around keeping older people safe in aged residential care during lockdown of facilities while also supporting their health and their well-being?
Kia ora, everybody, and thank you, John, and thank you to the panel. I think probably first of all, it's important to say that in aged residential care, we represent 35,000 of the most vulnerable group of all in New Zealand's older population. They are in our facilities, and their average age is 85. So we are certainly, as Ashley said at the beginning, the most vulnerable group. And we've seen that vulnerability and how it's played out with COVID overseas. So probably the biggest single factor in keeping our older people safe was the closure of the border. And we're very grateful to the ministry and to the government for going hard and going early. And I guess then secondly, it was closing down our facilities. And we moved very early in that with our facilities closing down. And I think it's important to say in this context that we always, throughout the whole period, did facilitate visits for compassionate grounds, or in the cases of palliating residents. Because we had a lot of issues that came from families on that point. So you look, they would have been the two single most important actions that helped keep our people safe. The other things around IPC, infection prevention control, hygiene, use of PPE, they go without saying, and we all know about that. And in a sector where we're looking after very vulnerable people, it is business as usual for us. We do deal with outbreaks such as norovirus and the flu, accepting that COVID-19 was certainly a step up. So I think in answering your question, those were the main things, John. I would like to touch a little bit more when you come back to me about the issues that we've put in place to support families, and more particularly around the mental health of our residents and the well-being of our residents. But I would leave it there for the moment.
Great. Thank you, Simon. Thank you. So I'm going to come back to Ashley in a moment, but Nairi, who introduced the session at the beginning, Nairi's busily taking any note of any questions that you may like to post in chat. So I've just got some questions I'm going to put to the panelists, and then we'll get on to questions from the webinar participants. So now I want to pose some questions about the future going forward from here. So Dr. Bloomfield, can you tell us about any meaningful solutions from health service providers and from the Ministry of Health that have helped to support older New Zealanders during COVID-19 lockdowns and restrictions?
Thank you very much for that question. I was just waiting to be unmuted. A little helpless there. I don't know the sign language, but please unmute me. Yeah, look, I think again, and to just hark back to the comment I made earlier on, one of the features of our response has been our willingness and our openness to learning and adapting very rapidly to reviewing and learning and adapting as we go. I mean, this was even right at the start. You know, we had a pandemic plan that was, well, we used to say an inch thick at 2.54 centimetres thick, with a great level of detail for each organisation, of both within the health system and beyond, about what they would do in the case of an influenza pandemic. And we got a few weeks into this pandemic as it emerged and realised if we kept following the plan, we were going to be in all sorts of trouble because we couldn't manage it. No country had been able to manage it in the classic way that the pandemic influenza pan was proposing. So we had to pivot our response very quickly. And I think again, in our broader response across New Zealand, both within sort of aged residential care and other residential settings, and also out in the community, is our willingness to listen and learn as a system, and clearly the Ministry of Health as part of that, has been a hallmark of our success. As I've said in my media stand-ups the last couple of days, you know, what we've done is all well and good, but it's what we do now and what we do next that really matters. And so what we have been doing, of course, is not not wasting the time with our preparations for reincursions. And I guess the ultimate is that we're able to be in a position, and this is what we're aiming to do, of course, over the coming week or two with the latest cases we have in Auckland, is to avoid going up alert levels and to rapidly deploy the range of tools, the ones that are there all the time, like our testing. And we've shown, as we did in the Auckland August outbreak, we can ramp that up, both community testing and our testing around the border, our surveillance testing. So we can do that, we can surge that up, we can surge our contact tracing capability up, and we've now got a national information system that allows us to, in a sense, move work around the country between public health units, which is just a fantastic asset that, again, a team here in the ministry, and I want to put a plug in for them, but also for everybody who actually saw there was a need and just did it without asking for permission. So a lot of our success today has been people seeing what needs to be done, and there were no guardrails there because we were all responding rapidly, and so they did a marvelous thing and stood up this information system. So the other part of this, of course, is the things that we can do in our community that everybody can do, and one that we've already used and deployed quite effectively in Auckland and elsewhere was the use of masks on public transport and on flights. And my sense is that part of our, and we'll be having this discussion, and I guess I just have to put my apologies in for the last half an hour of the session this morning because I've got to meet with ministers to brief them ahead of my stand up today. Our ability to deploy these things, and the critical thing here is to keep New Zealanders aligned with and understanding the why. Our success early in this outbreak was because when we went within the space of 7 weeks to there's a virus that might be a problem, to now we want you to go home, stay home for at least 4 weeks. Nobody said why, because we had taken them on the journey. And if people understand the why and the purpose and the vision and the sense of collective, the need to act collectively, then they will do it. And so our big challenge from here is to make sure that all citizens continue to understand the why we are asking them to do things at particular points in time. And I think that those generic things apply also into how we then ensure that our older people, remembering, and I think Murray's made this point really, really ably, whilst our, as Simon says, our most vulnerable older people may be in age residential care, most of our older people are out in our communities, and we're going to need to keep a sustained and sustainable effort in place to continue to look after them, whether we have the virus active in the community or not.
Thank you, Dr. Bluefield. That's yeah, it's very, very insightful. So the next question is to Judy. So can you share, Judy, any community-driven solutions that you might be aware of that have been there to support older people to managing the challenges?
Kia ora, and thank you, and thank you to my fellow panelists for their contributions so far. Yes, from the focus group that I ran, I was able to glean that in the Roskill area, which is one of the most ethnically diverse in Auckland, that Michael Wood set up a volunteers who came in and called every senior in the area. The person that I spoke to, who is a staff member of Michael Wood's originally, Asoka Basnaka, spoke about the fact that she had made 300 calls. She spoke about the fact that there was one volunteer who was an older person themselves who made 800 calls. That in fact, the issues that they were dealing with was that mainly it was actually inquiring from people, but also that some were trained to do online supermarket shopping and helped with their online payments. And in some cases, the person was dispatched to collect the supermarket shopping and deliver it to their home. So there was an issue around, community need that was actually met in that way. The other area, of course, that's important for older adults is delivery of free medicines, because you still need to keep your prescriptions and you need to keep your medications regime. on track. And so some pharmacists actually do deliver, but the volunteers were actually doing that as well. They were going and collecting medications and delivering it to the recipients. The interesting thing is that through all of that, I asked whether in fact there were any grumpy people who were not really appreciating the attention. And Ahsoka said to me, absolutely not. Every single one of the 300 people she called were very, very appreciative of being contacted in this way. They had issues sometimes to do with language, and it was necessary to have multilingual capacity to actually respond. So they had volunteers who, for example, could speak Chinese, and that was an important aspect. Apparently one of the Hindu temple set up a Zoom meeting because for older, socially isolated older people, the capacity to actually go and attend a monthly meeting at the temple is a very significant part of the social fabric of their lives. And of course, this was something that they could no longer do. And they set up a Zoom meeting to do chanting. And then that developed because of through that and the capacity to actually work on Zoom, they then organized some of the debates and information sources that was shared around the referendum choices that they had to make at the election. So it's interesting. Ashley speaks about the ongoing learning. And I do think that learning is certainly something that's a theme that actually works across everything that we're doing at the moment. It's actually coping with situations that are completely new to us, being able to look at how we can actually respond and respond in a nuanced way. And I'll give you another example of course, Eleanor Bodger from Christchurch talked about the student volunteer army down there that also did the shopping, but she felt that one of the most wonderful things is having an organic evolution of things within the community. And so that's where the teddy bears came in. And hopefully, you know, most people are not nodding off and going to sleep now, because there were also some disco dancing teddy bears as well. And so she said that capacity to engender a feeling within the community that we were in this together. And there's a sense of it not being a boring thing that you have to just slog through, but there are opportunities of being able to connect in ways that are playful as well. And I also know, but then I'm actually going to be gutting the contents of my little talk that I'm going to provide later. So I won't necessarily go there, but there's also a number of creative opportunities that were happening. And with that, I'll just step aside.
Thank you, Judy. That's really fascinating. And so I'll just put it out there to the participants of the webinar again. Please feel free to add any questions that you would like to put to the panel into chat. And I guess just picking up on a couple of things that you said, Judy, and maybe something that you were talking about, Ashley, is around moving forwards and the challenges of moving forwards. Because I know that in the first lockdown, you know, the teddy bears, everyone was on board, and you'd be walking down the street, you'd cross the road and say hello to people over the other side of the road. And there was a very community, a real sense of community. And I guess in the second Auckland lockdown, that just wasn't there. And so I guess looking at the challenges of subsequent lockdowns, how do we maintain that community sense? And so that we can support older people, because as you said, actually, the majority of older people in New Zealand are living in the community. But I'll put a question to Moe now. So Moe, you've told us around some of the innovative ways that the Wellington City Mission have looked at changing the way that you provide services. Are there any other opportunities, you think, for rethinking how we support older New Zealanders?
Thank you, John. There absolutely are, I think. And As a city missioner, I'm an eternal optimist, and it helps in this job because you get to see some stuff that's not much fun, but it's the opportunity to believe things can be. Pick up on those previous comments because I got asked by the media several times during lockdown what were my expectations of New Zealand not post-COVID, because clearly we're not post-COVID, but post-lockdown. And I said I hoped we would become a more caring, a more benevolent society that looked after each other better. The question is, has that happened? I think in pockets it has, but I'm reminded of a conversation I had with community groups in Christchurch some years ago, the year after the major earthquakes. And I posed two questions to the community groups there, because obviously there'd been a community growth and a community capability that had been developed as a consequence of a natural disaster. And the questions were, will you still be so connected when you don't need each other quite so much? And the second question is, for the rest of us, having seen what was some of the wonderful stuff that was created out of that incredible disaster, why does it take a natural disaster to even go there? And I guess the same things apply now. And we shouldn't make light of anything that we've had to face this year and will continue to face. But the question for us all is well, what are the beneficial things that come from here? So I've talked, when I've been talking about lockdown and the city missions response and other things, about the 3 C's of COVID for me. And those 3 C's are the challenges, the celebrations, and the changes. And the challenges are obvious for communities, for individuals, and particularly, I think, for older people. The celebrations, and there were some celebrations, and they were celebrations of the ability to do some things that we never would have had the possibility to do before, to rethink the way we respond to communities, to engage in a different way. From my point of view, to see the generosity of communities that came through very clearly for us over that period. What I also saw as someone who used to be in government and now pushes government quite hard is we got innovative and creative and courageous responses from government, unlike we've ever seen. My anxiety is now we're coming back to normality. I think the bureaucracy is reclaiming its space. So no reflection on health and Dr. Bloomfield, but certainly other areas of government. I think I keep challenging ministers to reclaim that place of innovation, of creativity, of courage. So there were some things to celebrate, and I think there still are. And the 3rd C was about changes. And for us, the city mission will never be the same again. And I don't say that with any sadness. I say that with the hope and expectation that we're going to be better at what we do, and we're going to serve people better, because we literally are changing almost everything as a consequence of the experiences we've had. And the unique ability, the unique time in our history that we could stand back from what we do and rethink it and say, okay, do we do it the best way possible? So for people like me who enjoy the process of change and the innovation and creativity it brings, it's really exciting. For other people in my organization, and I'm very conscious of this, change is scary, and we're working with people to look at that differently. We have a lot of home visitation that happens through our social work teams. That all changed, of course, over COVID. We use different mechanisms. We engage differently, and we're looking to maintain some of those as we go forward. Like many other organisations, we had staff working from different locations, particularly from home. And some of that yielded significant value in terms of what people were able to do. And none of these things in themselves are solutions, but they all contribute to a way of engaging with people and supporting people in what they need in a different way. I guess the challenge is to be prepared to take up those things and say, okay, we're going to be quite brave in this space, and we're going to try some things differently rather than just reverting back to what we knew before. So for us, engaging with our manahiri, our clients, a number of whom are older people, and thinking about what has this meant for them and how do we better serve them in what we do. We run an aged care facility, and in fact, we've had a remarkable winter. We've had almost no infections at all, and as a consequence both of infection control and had limiting visitors. And as I shared with Simon earlier, some of our elderly residents were quite delighted that their families weren't able to come for a few months. So you know, there are a few upsides of this, and it's lighthearted and it's fickle, but actually just ensuring that we learn from what we've been through, because it's been a tough journey and it will continue to be tough. And you know, we use food as a bit of an economic indicator, and I know we're going to see pain in the months ahead, particularly as we come up to Christmas time and into next year. And the economists are saying we're going to see some economic pain that will continue to reflect in demand for food. Judy made an interesting comment about brands earlier on, about people being able to choose their brands. One of the interesting things we didn't anticipate was that when we saw the demand on supermarkets very early in the lockdown, all of the economy brands were bought really fast. So the only things that left were premium brands, and the people that I'm here to serve can't afford premium brands, so they missed out altogether. So again, being responsive to things like that and understanding those signals, looking at our supply chains. In fact, you know, as an organisation, I think we'll be unrecognisable compared to where we were in, say, the beginning of this year. That's very exciting, but it also has some challenges.
Great, thank you, Murray. I love your 3 C's. So very useful. Now my last question is to Simon. And Simon, you've alluded to some of this already, and it's around solutions going forward for age residential care. I mean, I know that just coming back to what Murray said, I mean, a crisis often it makes us look for innovative solutions. And I know from my experience, the way that district health boards have worked with aged care facilities has been different during COVID. In some ways, quite considerably different. And so, yeah, my question to you is looking to any solutions you think that may have been reflected from collaborations that and solutions that may not have been there before COVID.
Yeah, look, I'll try and be succinct in my answers, John, because I'd be quite keen to have a conversation about the courageous decision-making that Murray talked about, it sort of in the whole policy space. So in terms of this, you know, keeping older people, keeping them healthy, but also maintaining their health and well-being, it's pretty simple, really. I mean, we've used technology. We've used technology more than we normally would. So there are all those mediums, like the ones that we're using now, that have been really, really important to maintain the contact between residents and family. Seeing the wider public has seen through this is
Sorry, for some reason, Simon, you're breaking up.
Okay, can you hear me now?
Yep, no, that's
okay.
Good.
We had a couple of facilities around the country, their own bubbles. We had nurses who lived on site with their residents in their own bubble and away from their family through the lockdown period. So there were sacrifices that were made in the interests of looking after our older people. And what that demonstrates to me is the real commitment that our nurses and our caregivers have towards the people that they're looking after. You know, we have seen the value of supermarket workers, for example, during the lockdowns. Well, equally, we've now seen the value of aged care workers. And interestingly, and it's only an anecdote, we are now seeing more interest coming into our workforce from New Zealanders who have lost their jobs and are wanting to work in aged care. And that's something that we haven't necessarily seen before. because it's a job that's stable and it's a job that's really valued. So I can't emphasize that more than I have around the dedicated workforce that we have. And I'd be really, really keen to open this conversation wider and talk about some of the courageous decision-making that did go on through, that's gone on through this period.
Thank you very much, Simon. So those are the questions that I had prepared. There are some questions from the floor. There's also your question, I think, from yourself, Simon, to the panel around courageous decision-making. So maybe we could just spend a few moments talking about that now before we go to the questions from the participants. So, what do you see as the courageous decision-making from your perspective that you've seen, Simon?
So what I think was unique about the period that we worked with, and it's a bit like this team of 5 million that the Prime Minister used. For the most part, we had industry and officialdom working together. We came together and there were things that needed to happen in the policy sphere. So examples in our area, for example, were around changes to immigration policy settings to support our workforce. And we got those changes through, and we got them through really quickly. We had relaxation on some of our audit requirements, and that happened really quickly as well. There were policy decisions that were made in hours and days that normally might take weeks and months. And I think that's because you could see officials working with industry. That's not to say that there weren't disagreements. There were disagreements. And you know, we had a big one, as Ashley knows, around testing. We were being pushed very hard around testing. I was being pushed very hard around testing on behalf of my membership. But we got through that. We found a pathway through that, and we came up with a solution. So it was almost like we were one team, and I don't want to be corny about that in any sense, but it was true. We had industry working with officials on those sort of things that haven't happened before. And from our point of view, I mean, the use of media is important. Murray's talked about the use of media as well. Mostly has been reactive, but certainly in the immigration space and being able to get the settings changed to protect our migrant workforce. When our messages weren't being heard from government, the media was really important for us to get those messages across. So, you know, I think decision-making was bold. And I think decisions were made really quickly, and they were made in the best possible interests of our residents.
Thank you, Simon. So Judy, Murray and Ashley, so in terms of Simon's comments there, do you have anything you'd like to add?
Do you want me to go? Am I muted? Okay.
No, we can hear you,
I
Judy.
can go for it, okay. I just thought I'd say to you that one of the things that I did participate in during the over the last sort of 3-4 months was getting involved in the Inspiring Communities with a group who were doing community development work. And through Margie Jean Malcolm, I actually was introduced to a wonderful Stanford Social Innovation Review article written by Hilde Gottlieb that talks about catalytic thinking, which really requires, it says here, creating a better world means asking better questions. And so to me, it's not just, it's about having the courage, and leadership sometimes requires courage and going there, but you really need to be able to ask the appropriate questions. And she says asking questions about people, about purpose, about resources, and changing the questions that are regularly asked to ensure that you create the future that you want. And I'll just leave it at that, because I think that's part of the paradigm that we have to change.
Great, thank you, Judy. Now, Murray, by your own admission, you're someone who loves change. Ashley, I guess from your perspective, I mean, you've heard Murray's perspective around change and changes that you've made. Judy, the paper you were just talking to, Simon's experience. So, Ashley, to you, I'd say, how do we sustain this culture of actually finding solutions as issues come up?
Well, thanks, John. I won't take it you're implying that just because I work in the bureaucracy, I don't embrace change. In fact, I
wasn't suggesting that at all.
Look, I think this was and I started with one of the I'm doing a few talks at the moment, lessons from COVID, and my first one is the power of collective action. And the opportunity now, and I think other panelists have hinted at this, is how do we bring that amazing learning to bear on some of these other challenging issues? And some of them are, for my part, are ways we could greatly improve the nature of the way we deliver services and the accessibility and the experience of and the outcomes from care in the health and disability system. But also, of course, some of these other huge challenges that as a country we want to address and put our collective energy into: environmental sustainability, child poverty, housing. Murray's alluded to. How was it that in the space of a couple of weeks we suddenly found housing solutions for our homeless people in this country? What does that say about what is possible, and what is it in the system that is preventing us doing that? So I think fundamental to this will be our ability to harness our collective citizens' energy and focus and support for that common sense of purpose. And I think the other thing I would just want to allude to is, for us, we saw some phenomenal changes in the health care system that didn't require the Ministry of Health or those informal decision-making or in government decision-making roles to make decisions. So we saw primary care in the space of a few days shift from delivering all its consultations effectively face-to-face to wanting to deliver up to 70%, and they just got on and did it. Now, if we'd gone through a usual process, that I thought was a 5 to 10 year journey to do that. The challenge is, as with many other parts of our response, the system is designed for pre-COVID, and so it will revert back very quickly to what was if we don't intervene actively and amplify and capture those changes. And that's some of the work we're trying to do now. So I think, a key learning for me was many of the successful actions happened in spite of the bureaucracy, or because the bureaucracy actually changed its way of working, took the trainer wheels off. No one, we had these huge changes in the healthcare system, and no one said, who's accountable here? Or we didn't change any structures. Yes, we put more money in, of course, but arguably that's money that perhaps could or should have been invested in those things anyway over preceding years. And all we have, the only thing that changes now, of course, we're in a challenging fiscal position, is we need to be clear about where we want to make those investments and not put up the barriers to making those investments when we know they will be achieving outcomes that as a nation we want to achieve and that we are prepared to invest in.
Great, thank you, Ashley. So, Murray, any comments from you around that discussion?
Yeah, a couple of things come to mind. One is that we made a number of new friends during COVID because we were not forced into, but it became opportune to sit with other people way more closely than we had done in the past. And for example, our DHBs and their addiction services and their mental health services became regular connectors with us in a way we haven't seen before. And that enabled us to respond collectively more effectively than we would otherwise. And those relationships have lasted beyond the end of lockdown, and that's fantastic because it prepares us to be better in the future. Clearly, some things were achieved over lockdown that, as Ashley has indicated, wouldn't have happened otherwise. I mean, we had this this homeless strategy that never saw everybody off the streets for any time in the near future, and yet it happened. The challenge is, how do you make it permanent? And that's the message I'm giving to ministers and to officials on a regular basis, along with coming up with some suggestions about how they might do it, because you never just want to pose a question, you want to offer a solution. And I'm mindful that it is about resourcing, and it is about being clear about where priorities lie. One of the things that I used to say to donors when I'd ring them and thank them for their support was, there was three values, or there's three things that came out of the gift they gave us. The first was, obviously, it enabled us to do some things, to buy some things, or to commit to something. Secondly, it was a huge boost and encouragement to my staff, who were working pretty much 7 days a week, constantly trying to meet the needs of the community, and the people who were supporting us was huge. But thirdly, and probably most importantly, it enabled us to make decisions without having to worry too much about where the money came from. So you did things fast and you did them well. And what I've been reminding ministers is that just because we made fast decisions doesn't mean they were suboptimal decisions. They were actually good decisions in context. What we now need to do is to live into the expectation or the sense of possibility that those decisions have led us to. And I think that positions us really well as a country. Yes, we are going to have huge challenges going forward, but I think we've demonstrated an opportunity to work differently and be different than we have been traditionally, and we should grab that at every opportunity.
Yeah, thank you, Murray. Now, this is an interesting question I'd like to pose to the panel. So, human rights and public health imperatives. So that they came together for older people in COVID. Do you think there's a conflict there? Do you think that we struck the right balance?
I'm happy to start on that one, John. That was one that we encountered every day, was balancing the human rights perspective in terms of families being able to see their loved ones and care versus health. We always erred on the side of health, given the acuity of our residents. And that meant that we didn't always have very happy families. In fact, we had, in many occasions, very unhappy families. And that showed itself in a number of different ways through the first lockdown. Although by the time we got to the second outbreak in Auckland in August, I think there was a much better understanding of the dangers posed by COVID. But I really think that that is one of the issues that I would like to bring to the surface and actually address, is where is the balance between health and human rights? And I actually don't have the answer to that one, but it's a discussion that we've absolutely got to have, because it was one of the prevailing themes throughout over the last 6 months.
Okay, thank you, Simon. Any other comments from the panels in terms of that balance between human rights and public health?
Yeah, if I may, thanks, John. I mean, Simon's hit the nail on the head here. It's a tension, but it's not that they're mutually exclusive. And every bit of every order or legal instrument that we advised the government on and that they made a decision on needed to have a look at what the implications were from a Bill of Rights perspective. And people will well know that I've subsequently been, whilst we locked the country down in March, it's subsequently been determined by the court that the Prime Minister and I did so illegally for at least 9 days. But I think, one of my lessons I talk about from COVID-19 is there's a huge steer from the public here, and one of my big lessons has been it probably doesn't surprise many of us, but people actually value being kept safe and looked after, and the only institution that ultimately can do that for its citizens is the government. And the high level of support that there was for the lockdown, and for yes, there were tensions in a number of areas, like access to visiting loved ones in residential settings. Of course, many people couldn't go to births or celebrate the passing of loved ones during that period. So people made enormous sacrifices, but the overall level of support and the extent to which so many New Zealanders took up that collective invitation to crush the virus with kindness, I think is a huge steer about just where our values do lay. And of course, that doesn't mean we shouldn't keep an open and active discussion around this, including for New Zealanders coming back into the country, around whether the settings at the border are the right ones, what else we could do to keep getting the right balance between minimising the risk to New Zealanders, and particularly to our vulnerable New Zealanders, but also allowing people as much freedom as possible, because at the end of the day, people will, and rightly, start to question, have we got the trade-off right here? Are we sacrificing too much in the interests of the pursuit of minimising any infection or poor outcomes from COVID?
John, could I comment on a couple of things? Firstly is that I watched some of this play out where there was this conflict clearly between individual rights and public health outcomes. What struck me was the contrast between that and the communities we were serving, who were actually deeply respectful and appreciative of the limitations that were put in place, because they understood the value that had. And we operated some services that had people coming to our door and having to operate through sort of airlocks and things to try and avoid contact. Nobody complained. When people had to queue occasionally, they did that very respectfully for each other, and they kept their distance. So I did see a contrast of entitlement between those who perhaps were better off and those who weren't, which is an interesting social impact, I guess, to explore at some point. The other thing I'd say is, and if I've got a fourth C for COVID, it's probably the question about complacency. And I have a daughter living in California who watches New Zealand politics and New Zealand media very closely. And in the community she lives in, and she's been in lockdown since February, and her workplace has indicated they won't be back probably until the end of next year. They're facing significant challenges and huge rates of infection and mortality in California. And her comment to me was, I can't believe people aren't taking it seriously enough in New Zealand. And so when she watches us and thinks, because of the work that Ashley and his team and the government have done, we're in a deeply privileged position. The question is, are we going to take advantage of that, or are we going to be way too complacent and relaxed and therefore perhaps lose the gains that we've made? And it's interesting for me to get that perspective from someone external to New Zealand, who is in the middle of a very difficult community and scenario in the country she's living in, and to be challenged on that about why aren't we taking this more seriously.
Thank you, Murray. Now, there are some great questions coming up. I know that we only have just over 20 minutes of Ashley's time left, but the rest of the panel are on until 12, which is fantastic. So one question that I think is probably aimed primarily at you, Ashley, is around the use of routinely collected data in decision making. So what do you think was missing? And what could we look at collecting going forward that would help?
Yeah, thanks, John. And I saw that question. I think it's a very good one. Two observations to make. I think the gap in our system is not in the collection of the data. It's how we enable that data to be linked up and easily accessible to inform decision making. And that's the challenge for many systems, both the healthcare system, but really government, is we have in a sense a wealth of routinely collected data. And in this case, the question is about clinical data. That the aspiration is, and we're moving towards this, is how do we link up the data that's held in a whole range of different places for a range of different reasons in a way that allows individuals and whānau to make decisions, but also clinicians in partnership with individuals and whānau, and of course planners and policymakers, so we can at a population level make decisions. So I think we're well served by the data we have, and our ability in the healthcare system to link that through a unique identifier, the NHI, is great. So that's the gap, and we're working on, and we've got a business case that I think is going to go through and be funded, and that is around what you might call a national health information platform that allows those linkages to happen, and that will serve us really well into the future, and including how we might better deliver services for people. But the biggest gap was not actually in clinical data, and I've touched a little bit on this. It was actually our deficit in our public health data and our ability to link up our public health information. So we've got these public health units around the country, 12 of them, that were all running in essence cottage industry information systems on Excel spreadsheets for contact tracing, when along came something that clearly needed not a cottage industry, it needed something that was linked up. And so our ability to put an information platform in that now allows sharing of not just the public health contact tracing information, but laboratory results and clinical information and information from the NZ COVID Tracer app to push notifications out to get up-to-date information on people. I think that was, again, a great example of people doing something that otherwise we would still only be on the first phase of of getting the money to write the first business case to do it. And so I think this is the point that's been made elegantly by Murray and others, that actually, if we've got a common sense of purpose and understanding of the value of something, that willingness to really get in behind it collectively and make it happen. So I think our data are there. They will serve us well if we are willing to rapidly move to enabling better access to it, including for individuals and their whānau.
Okay, thank you, Ashley. Now, I guess a question that's come up from the participants, which maybe reflects back on especially what Murray and Judy have been talking around, and that is, we've got some great suggestions, we've got some great examples of what's worked really well, but how do we sustain that? How do we, what are the specific steps going forward to ensure well-being of older people based on the learnings that we've had over 2020?
Do you want me to go first?
Okay, Judy,
I'll go first. But first of all, I'll just add in a little comment about the previous question, simply because part of what I did online was to participate in a whole lot of things related to data, and I had to make the comment that basically there were very few women involved in those discussions, and so I'm just going to add a little comment here as a woman, because I started off my very first job in the 70s was as a computer programmer. And so basically I've been involved in data and interested in data. And the thing that I am also interested in is that basically, yes, the interoperability is important. So getting the linkages, but also the important thing is to remember, please, the cybersecurity risks associated with those linkages, because I know that there are ethical concerns around that and the consenting concerns around who accesses data. So from a health consumer's perspective, I just need to make sure that's there. Two other things related to that, and that is that basically there is a digital divide, and so there are people who are excluded from that conversation and participation, not only individuals, but in fact, if you travel the country and you're trying to use Facebook or something like that, you'll discover that in the car, you'll discover there are places that don't have access to digital networks. So we actually need to have a digitally connected infrastructure that enables a platform that's envisaged. So enough of that, and going on to how we enable solutions. And I think this was Charles Waldegrave's question, how we have a sustained approach to enabling people to age well. One of the things, I'll just make two brief comments. Firstly, I'm delighted to see that this COVID crisis has actually increased the visibility of older people in our community. And I do think that helps address the rampant ageism that is there. And I'll give you an example of how visible it is. by telling you about an invisibility story. So my husband and I, one of our first outings when we came out of lockdown was to go to the Auckland Art Gallery, where they had a magnificent photographic exhibition. And we went along because we're members on a curated tour with the curator. And I said to the guy, it's really, really sad that there are no images of older people in this, or they're very, very few. We're absolutely invisible here. And he said to me, but you can't change the way artists work. And I said to him, but you can change the way you curate these exhibitions. And I also said to him, it would be really nice next year when Auckland becomes an age-friendly city that you include some images of older people. And he looked at me and he said, what? And I said, yes, we're becoming an age-friendly city. And he said, what? He'd never heard of age-friendly. He'd never heard of the age-friendly city movement. And yet he's an employee of Auckland Council, ultimately, in a CCO. But in fact, that notion of actually what it is about age friendliness that allows you to accommodate people's needs and their capacities to grow and develop throughout the life course is really, really important. So the second point I was going to make was actually, I do think that the age-friendly city and community model, however flawed it is, that basically it has actually helped us develop an agenda that actually addresses some of the issues related to growing older.
Great, thank you, Judy. The question I'll pose to the panel again is around how do we continue to find solutions?
John, can I perhaps comment first?
Yeah.
I think we should focus on nurturing and treasuring the collective memory we have. And by that, I mean reminding ourselves of the things that we learned, particularly when we were intensely locked down. And because there were moments in that process that were deeply powerful. And you know, I had a group of staff that came together over that time, and we built amazing things as a team because we were committed to a particular task. I drove to work without any traffic, and that was wonderful, and I could park anywhere I wanted. And I'm not suggesting we adopt those things, but I am saying that how do you take some of that stuff and make sure that we think about incorporating that into our planning going forward? Judy commented on gatherings of people, such as churches. What we saw is a lot of churches go online over that period, and the ones I've seen who have been particularly astute have maintained that now that they're back meeting again, because for some people an online connection into a church community actually suits where they are and what they're doing. And we've also seen people working from home. We've seen the property market respond differently, particularly for outlying areas outside city centres, where people are looking to work from home more. And it's about saying utilising those things without allowing them to be sort of defining factors, but saying how do we inject that into our thinking and our processes so that the value and the learning that came out of level 4, level 3 lockdown gets retained in our collective memory.
Great, thank you, Murray. Okay, so another interesting question that's coming up, which I think reflects on the discussions that we're having, is that, you know, that there has been a lot of innovative solutions seen that would have been unthinkable without COVID. You know, that there's been a lot of hierarchical structures that just have disappeared and solutions have been made. Is that something that we want to continue to explore going forwards, or if the hierarchies do become prevalent, because they are there for a reason, obviously, how do we maintain in some way the equity and equality that we've seen across health and service delivery, health and social service delivery? Anything?
I'm happy to make a comment to kick things off, John. I think, again, just building on Murray's comment, you know, our failure in imagination is not usually in our ideas about what to do. Our failure is to imagine how we can implement them, and to get on and do things. And we had this situation where we could just follow our imagination, and we did things. And my goodness, you know, not only did the sky not fall down, but we achieved more than we ever hoped we could achieve. This is one of my lessons from COVID-19, and to pick up on what Murray said is, and I completely agree with him, and I'm trying to give talks to as many audiences as I can about lessons from lockdown or lessons from COVID-19. And one of them is, for goodness sake, we need to slow down. Even for those of us who were working, many of us long hours during that period, there were many gifts. There was the gift of sitting out on the back steps in the sun on the weekend for an hour and hearing nothing but the birds. And where did all those fantails come from? And they're there all the time, but we just don't notice them. For me, I had my whole family home, and there was a gift of 8 weeks together with two of my children at home that never would have happened. There was the gift of nothing to do after dinner except a puzzle or a game of Cluedo. And I think that realization that actually our well-being as individuals and as whānau are so intimately linked with the well-being of our wider community and of our environment and of our, you know, our nation. And, you know, the Māori, Sir Mason Jury's model of health that's been around for a long time, whare tapa whā. And that realization that Te Taha whānau is about us as not just our immediate family, but us as a whānau, as a community, a whānau as a nation. And of course, Māori, in Te Ao Māori, they get this, and that's why you saw them act so decisively and swiftly and effectively as iwi to protect initially it was to protect their older people, their kaumātua and kuia. And so we need to overcome our failure of imagination in implementation, because we have the ideas that we know what needs to be done, and we need to capture the lessons from COVID-19 to date and translate those into other areas that we know we want to make a difference in.
Great, thank you, Ashley. Any other comments around that from the panel?
Just to add on to what Ashley said, two of the resources that we were given during lockdown that we found very powerful. One was a video that came out of, I think, Auckland Tourism, called Papatua Nuku is Breathing. It was a fabulous thing to show to our staff. It's a video on YouTube, because it said that the country's pausing and reconnecting itself and establishing itself to launch again. And that idea that we use the opportunity that's available to us to become better in the future is a powerful one. And the other thing was a piece of writing that someone sent me called Entering the New Country by Henry Nouwen. And it talked about taking tentative steps into a new country. And then you step back into the old country because it feels more familiar, but you realize the old country's changed and you no longer belong there. And then gradually, as an iterative process, you become more and more comfortable stepping over the border. And that idea that change is difficult, but actually if we explore some of the value add that's come out of the experience we've had collectively, then actually there's an opportunity to recreate it, or to create a new future that looks different, that's better, that is the new reality that we're faced with having to deal with. But let's not look at it as a chore or a suboptimal outcome, but let's look at it as an opportunity to be better than we were before.
Great, thank you, Murray. Simon, Judy, anything?
I just think it's important that we bed in a process around the learnings. It was a dynamic period of certainly the first lockdown of over 3 months nearly. So it's really important that we bed in a process around the learnings, and we take that on board and action it. I mean, certainly in specific to aged residential care, we have a process to do that, and we're already engaging to make that happen. So we've just got to. Ashley's right. We've just got to slow down and reflect on the past 6 to 8 months, and take that learning forward, not just in terms of COVID, but in terms of all the other things that we work on as well. I think that's really, really important.
Yeah.
And I will just add to that. Yes, I think very often when you pause to take a breath, and as someone who practices yoga, I just know how important breathing is. As someone who's an asthmatic, I also know that I wish that somebody had explained to me about the importance of breathing properly, and breathing to help control anxiety. Breath is absolutely essential to life. And if you slow down breathing, you actually allow all sorts of other opportunities to be noticed. So that's my contribution to that discussion.
Great, thank you, Judy. And so I guess one challenge that comes up from reflecting what you guys were just saying is that especially during the first lockdown, that there was a group of older people, a small group of older people who were in fact not able to sit with their whānau and not able to connect socially. And also there's a group of older people who perhaps, that the ability to go onto Facebook or Messenger or Zoom was not there. And so any comments from the panel in terms of loneliness and isolation and for that group of older people who may have been more lonely or more isolated during lockdown? Anything that we could do to support them?
So could I start that? I think probably it's not our group of people that you're talking about, John, because our group of people did have the support, because they have the staff support to be able to make those connections with family. But I think you've identified a really salient point here, that there are those people in the community that don't have that support. They don't have family support either. And actually that's the group most of all that we need to be thinking about here, and how we confront that challenge.
And certainly the population of older people that we deal with, many of them fit in that category. I talked earlier about the huge benefit we'd seen come out of reconfiguring a space to become a community lounge. And we've seen people just be enjoyed, be just so excited about the opportunity to connect with others. And that's been really, really powerful. Because I think one of the biggest challenges of our community is people who stand alone and don't have connection. And what we do know is that often people who are isolated by virtue of circumstance or family or economics or community cope with lots of things, but actually the biggest challenge for them is a lack of connection with other people. And whether that's over the telephone or whether that's over some sort of technology, or more importantly, perhaps today, it's about having face-to-face engagement and creating those opportunities for people to connect with other people of their own demographic, but also other people in the community.
Thank you, Murray.
I'm really interested in the fact that, having done a doctorate that used a social networking tool, I would just love for every GP to have information with your health record that reflected information about your social network, because I do think it offers an opportunity to actually consider the social well-being. And if you're looking at Summation Jury's holistic model and approach to delivery of healthcare, you really need to take account of all of the aspects. And I think there's an opportunity to target the needs of people and reach out proactively to actually have them involved in some sort of community interactions or social interactions, so that you actually don't end up having to reach out to them in a crisis situation, that in fact they are have some sort of linkages that are able to support them in some way. And I do know that Age Concerns visiting, their visiting program does an immense amount of work in this detail. So I just need to mention that as well.
Okay.
John, something that comes to mind for me is a conversation I had some years ago, again, related to Christchurch earthquakes, when older people were relocating into a particular community in Christchurch. And the way the community groups had responded was to not go and visit when people turned up and ask what they needed, but they went to visit and said, if you're going to live in this community, you have a role to play. And here's the job we've got for you. And it might be to watch the neighbours' kids go to school each day and return home or something like that. But the idea that you're not just connected, but that you're a contributing member of the community. So what does the job look like that we're going to give you to do? And a lot of the work that we do is thinking about how do we engage in a way that's about enhancing mana or dignity. And often that's about allowing people to contribute in whatever way they can. So it's not just a matter of connection, it's a matter of meaning and contribution and value that comes from that.
Thank you.
It's also that capacity to get the feedback loop going. So if you have a sense of purpose and you deliver, that in fact it's recognized within your social setting and it's reinforced. So it needs to be a social learning, culturally appropriate response. Yeah.
Okay, thank you. And just a question that was posed a while back by Shirley and linked to Aisha's question too, which is around digital technologies and exclusion of some older people and the experiences of that group of older people who may be digitally excluded. So is there anything from the panel there around the experiences of people, older people who may be digitally excluded from participating in things like Zoom or other mechanisms?
I just say one thing. I don't think we should assume that it's easy for anybody, and it's certainly one of the challenges that all of us face, actually, not just older people. So we need to be mindful of the challenges that technology poses. It's just not an easy medium for everybody. And I don't know what I don't know what the solution is there, but we've got to think of better ways to do that as well.
Okay. Interestingly, so Jenny Cameron just posted something in response to one of the panel comments just now. So just reiterating the inter-eye needs assessments, so the home care inter-eye assessment are available for GPs to access. I guess that is an ongoing issue, is the use of inter-eye data. So for example, I know that a lot of older people in the community would have had an inter-eye home care assessment, and that is seldom used when they go into an acute hospital. So yeah, I mean, I think there's work there that we can definitely do. Okay. Any other comments from the panel?
Can you just repeat the last question, because
It wasn't a question. It was just a comment. Really, Judy. It was the fact that you were saying around the use of data by GPs in terms of social networks. And so
Yeah.
Jenny Cameron pointed out that GPs have access to the inter-eye home care assessment, which has information in there around informal support that people may have access to.
Yeah. That's if you've had an inter-eye assessment done.
Yes.
And so one assumes that you have to have had a health event to have that done.
Yeah. No, very true.
It doesn't necessarily reach everyone. I just would love to see everybody, have right from, school children, so that you can actually watch them change and as they grow older.
Mm-hmm.
And I think when it comes to looking at social contacting and being a little bit more nuanced in the way you apply a policy, it might actually be that in future there's an opportunity to look at the sorts of social networks that are likely to be the ones that are the super spreaders, and target messages in a different way to that group, as well as pick up the ones that are socially isolated.
Yeah. Okay, any other questions from the webinar participants? Or any questions you feel that haven't been addressed as yet?
Just in the meantime, thinking about the technology issue again and the unintended consequences that happen when other circumstances happen. And what I've got in mind is that we had the unfortunate situation in the last year or so for the Central Library in Wellington to be closed. And for those who access books, that's a tragedy. But more than that, it was a place where people gathered and a place where people connected and a place where people used the Wi-Fi. And so again, thinking about, rather than just thinking about it being, you know, an issue around a library, it's an issue around a community connection point for a whole lot of things, including access to technology. And whether that's communicating with family and friends, whether that's browsing the news or whatever it is, when those sort of consequences happen, just been thinking about how do we respond to that as a community? What is our response, not only to not having the facility, but how do we respond to the inherent challenge that's created by not having that connection available?
Okay, thank you, Mary. That's really okay. So now a question specifically to you, I think, Simon. A number of people who have identified that they'd like to thank you for the effective response on the part of the aged care sector. But what do you think was it that enabled the facilities to act early and effectively?
Sure. So in New Zealand, we're fortunate that the peak body that I represent has more than 90% of the beds within the aged residential care sector. So it is indeed representative of just about every rest home in New Zealand. And that gives us a voice, and it gives us a voice that's noticed. So we, like the government, went very early with our messaging, and we went public with our messaging as well. And because we have that reach across, you know, virtually every rest home in New Zealand, and it's a respect. I don't want to be boastful. I'm not a boastful person, but it is a voice of integrity and a voice of respect. And so when the association came out with very strong messaging about the need to protect our residents and the need to close down facilities early, it was a message that was acted upon. Sure, we had some deaths in New Zealand in rest homes. We know about the 2 rest homes that did have those deaths, but actually we had no more than 78 residents affected out of 36,000. So it was the very fact that we went early as well, that our voice was recognised and was respected, other jurisdictions don't necessarily have an industry body that has that kind of coverage, and that convey those kind of messages. So that along with the government's actions was why we had a largely successful outcome for aged care in New Zealand.
Can I comment on that, John?
Yes.
Simon, as an aged care provider, can I say thank you? It's not boastful if I say nice things about you. So, I mean, the clarity of messaging we got from the association was just awesome. It was incredibly helpful in terms of us making decisions about how we were going to apply the rules to our facilities. So, so well done, because actually you're quite right. Along with the government, you guys were instrumental in keeping our older people safe in facilities. So thank you.
Cheers.
Can I pop in here? And I'm just going to recap. Apologies, I had to rush out and let the black cat who was reclining behind me out of the study. So I had to, and I missed a little snippet. But I noticed there's another question about the inter-eye data. And I have seen on a health quality and safety a presentation about quality improvement where inter-eye data was used. I think this was done in the Deep South and in the Invercargill area, where people, they do record whether people are socially isolated or lonely, I think. And that was used to actually intervene with people with severe depression. And I think I'm quite right that, I'm sure I'm right in actually remembering that particular poster that was presented at a conference. It's Health Quality and Safety organised. And about digital exclusion, I'm going to just tell you a little anecdote from yesterday, because digital exclusion has huge ramifications for the way data is collected in New Zealand. And yesterday I participated in a wonderful hui arranged by Shanti Amaratunga and Karen Witten and Bridget Burdett. And this was part of the HRC research about inclusive streetscapes. And they had a wonderful fire, Dolly Paul from Te Puea Marae, who was involved in the research, and she was there also to speak to the story that she had told about not being digitally excluded, but actually being excluded from access to all sorts of parts of the environment because of slapping in a great big highway. But the wonderful thing was that she had this young person sitting beside her. And we were introduced to the young person at the end, and the young person was her granddaughter, who was her technical expert, who was helping her navigate Zoom, and also not only that, learning from the stories that she was hearing. And she said, I can't believe what you do in your time when I had absolutely no idea that you were involved in something that's as important as this, that is actually going to help the community put forward their stories about how inaccessible some places are. So that's about, you know, an intergenerational digital story that's really useful. And I do think that we need to enhance those sorts of opportunities, not just within whānau, but also I know that, for example, Kristen School on the North Shore of Auckland, for the International Day of the Older Person, they have a special day where they invite seniors from the community to come and spend time with their students to learn digital skills. I also know that Auckland Library has a wonderful person called Dr. Greg Morgan, who's responsible for their digital strategies. He worked with the Seniors Advisory Panel in the inaugural panel and was instrumental in trying to socialise the notion of age friendliness. But he's also very clued into trying to develop digital capabilities within the senior sector, particularly around accessing things like talking books, using the library, to help, and I presented a paper at the International Association of Gerontology and Geriatrics in Gothenburg last year that talked about a smart, age-friendly Auckland. And some of the stories that I told in that were anecdotes from the library, where a 94-year-old was going in and learning how to set up GP appointments using access within the library. So yes, you know, Murray completely agree that in fact Auckland will have lost, Wellington will have lost access to a community hub when they decided that in fact they had to close your city library. Yeah. Sorry, and then the final story was I started off with the hui yesterday. I joined a breakout room, and who should be there but an amazing lass who was joining us from the States. And she said, I've met you before, Judy. And I said, really? And she said, yes, you employed me as a census collector in 2013. And I said, oh, you're quite right. I remember that. She was pretty damn marvelous, and she's gone on and got a doctorate. But one of the things that I said to her was, my goodness, they did stuff up the census in 2017 by going digitally, without actually recognizing that we have a significant digital divide in this country, and that's impacted the data collection considerably. Mm. And that's what happens when you get smart, geeky technologists who aren't connected with community, designing systems.
Yeah, thank you, Judy. Okay, so I think we're coming to the end of the questions that people have posed. So you've got another couple of minutes if you feel that I haven't asked your questions to the panel, or you have any other questions that have come up. Any parting words of wisdom from Simon, Judy and Murray?
I can start first, John. We're not out of the woods yet. We've heard this phrase so many times, and it's true, and which is why Ashley has obviously had to leave early. So, you know, we as a sector are in a perpetual state of preparedness and readiness for further outbreaks, and you know, that's quite taxing on our sector, but it's the position that we have to be in, and I don't want it to be all doom and gloom, but what we are doing is we have learnt a lot over the last what's nearly 8 months now, so that we are well prepared and we are ready for whatever eventuality should come. So, you know, it's just a kind of a word of caution, really, going forward.
Thank you, Simon.
John, I would echo those comments of Simon's. I mean, we're very careful on our language. We don't talk about post-COVID because clearly we're not post-COVID. We're post, 2020 level 4, level 3 lockdown, and we only needed to hear the news headlines this morning to be reminded of that. But I think we should go forward with optimism, but caution, and let's not be cavalier about the situation we're in. I mean, where else in the world would you want to live at the moment apart from New Zealand? And so let's take the advantage of that, but not be complacent by virtue of the fact that we have it. And I think it was Winston Churchill talked about never wasting a good disaster. I think that's probably an unfortunate turn of phrase because it undermines the losses and the challenges that happen to people in the meantime. But it does say we take the good things out of what's happened to us. And as we've talked about this morning, there are some lessons and some learnings and some experiences that will make us better in the future. We've just got to take advantage of that, but be very careful as we step through this and be mindful of the need to look after every part of our community well. So, but be optimistic, because I think there is an opportunity to come out the other side of this better than when we went into it.
Great, thank you, Murray. And how about from you, Judy?
I will talk about my involvement in the PHO, because I do think that the PHOs have felt, and primary care in general, have felt very much that they are the Cinderella part of the health service, that they do an awful lot of heavy lifting, as Cinderella did before she went to the ball. But basically, there's not been a Ministry of Health prince who's going to be able to, or godmother who's been able to actually enable their contributions to be recognised. And so when I contacted in my focus group the head of the general manager operations at the PHO, at Comprehensive Care PHO, who, by the way, started the job just a week before COVID really needed to be responded to rapidly. And I asked, what contributions he felt that the PHO themselves had made. And he said that in terms of that they provided extensive support for flu vaccination clinics during COVID, and that they were funded for the eligible populations, which was largely over 65, and almost entirely these were provided as drive-through clinics to manage the transmission risk. And that basically a lot of the PHO staff went out to support clinics. The clinics provide that. I also asked Heidi McRae, who is the chair of the board, and she's a GP, and she commented on the fact that in terms of what they noticed, it was social isolation, loneliness, loss of independence, having to rely on others to do shopping. She commented about the fear of accessing medical care and not necessarily being up to using virtual care, and that the hospital system was mainly often virtual. But she counteracted that with a number of positive stories, including of a 94-year-old old lady who stopped reading on her balcony as everyone who passed by shouted, offering help, so she could no longer continue her reading. And the other important thing was that they cold called all over 80s and frail during lockdown to check with them. One of the things that I noticed is a huge weakness in the age-friendly city model, because the whole community and social welfare aspects, community health and social welfare aspects, are compromised by our lack of data and connectedness between local government and primary care in New Zealand. So that's me.
Thank you, Judy. Okay, well, I think we've come to the end of the fantastic panel discussion. So thank you very much for Dr. Ashley Bloomfield, who had to leave early. As we all know, he has a busy morning ahead of him. Thank you to Dr. Judy Blakey and Maui Edridge and Simon Wallace for your fascinating insights this morning. It's been fantastic talking to you. I've really appreciated your time, value your contribution to the webinar, and also the difference that you've made to the health and well-being of older New Zealanders during COVID lockdown. So thank you. So unohia, tepo, tepo, ke watea, kia watea, aira kua watea, tuturu whakamawa, kia tina, huie taikie. So draw the discussions and ideas from the space, clear the support pillars and the following, hold fast and secure. Thank you very much.
Thank you.
Thank you.
Okay, I'll just step in here to echo my thanks to the panelists for what was a very stimulating discussion. And didn't that bring us all back into focus, thinking about older people and how things are going to go for the next transition that we have into our managing COVID rather than the COVID lockdowns. So my job now is to thank the panelists and to thank John Parsons very much for what was an excellent leading of the discussion through the last couple of hours. And again, to reiterate, thanks to our sponsors. The Selwyn Institute is the major sponsor for today, but also National Science Challenge, Perpetual Guardian and Ryman Healthcare. And I know there's another slide with many more sponsors on it, and we want to thank each and every one of you for supporting this joint effort between the New Zealand Association for Gerontology and Age Concern New Zealand. Now, if you've hung on this long in this webinar, you better join the association. So look up New Zealand Association of Gerontology on the web and go ahead and join. We're keen to have new members. Just a reminder, we have one more webinar in the series, which is next Thursday at the same time. And that is specifically for students and emerging researchers, where we will lead them through presentations by Professor Deborah Waters in Writing for Publication and Associate Professor Andy Towers in the Imposter Syndrome in Academia, something that we all suffer from. And with that, just to remind you that the webinar will be available on the Age Concern New Zealand YouTube channel. All of our series are available there to watch for as many times as you'd like. And I want to add my personal thanks to you all for giving us your time today in thinking about older people, and encourage you all to continue your wonderful efforts about keeping older people, assisting older people to be healthy and well through this next period. Thank you very much, and signing off.